Zyprexa, also known as Olanzapine, is used to treat certain mental and mood conditions such as schizophrenia and bipolar disorder. It can also be used along with other medications to treat depression. This medication can help decrease hallucinations, improve clear thinking, and help individuals feel less agitated. It belongs to a class of drugs called atypical antipsychotics and works by helping to restore the balance of certain natural substances in the brain. It is important to talk to your doctor about the risks and benefits of using Zyprexa, especially when considering use in teenagers. Always follow the doctor's recommended dosage and timing for taking this medication. Before taking Zyprexa, it's important to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food, as directed by your doctor, usually once daily. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. It's important to take Zyprexa regularly to get the most benefit from it and to take it at the same time each day. Even if you feel well, do not stop taking this medication without consulting your doctor. If your condition lasts or gets worse, be sure to tell your doctor. Some common side effects of Zyprexa include drowsiness, dizziness, lightheadedness, stomach upset, dry mouth, constipation, increased appetite, or weight gain. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. Dizziness and lightheadedness can increase the risk of falling, so be sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, if you experience any serious side effects such as difficulty swallowing, shaking, slow heartbeat, fainting, mental/mood changes, numbness/tingling of arms/legs, yellowing eyes/skin, severe stomach/abdominal pain, trouble urinating, or interrupted breathing during sleep, notify your doctor right away. Zyprexa may rarely cause an increase in blood sugar, leading to or worsening diabetes. If you experience symptoms of high blood sugar such as increased thirst/urination, inform your doctor immediately. If you already have diabetes, be sure to regularly check your blood sugar levels as directed and share the results with your doctor. Your doctor may need to adjust your diabetes medication, exercise program, or diet. This medication may also lead to significant weight gain and a rise in blood cholesterol, or triglyceride, levels, especially in teenagers. These effects, along with diabetes, may increase your risk for developing heart disease. It's important to discuss the risks and benefits of treatment with your doctor. In some cases, Zyprexa may cause a condition known as tardive dyskinesia, which can be permanent. Notify your doctor immediately if you develop any unusual or uncontrolled movements, especially of the face, lips, mouth, tongue, arms, or legs. Zyprexa may also increase the production of a natural substance called prolactin in your body. For females, this increase in prolactin may result in unwanted breast milk, missed/stopped periods, or difficulty becoming pregnant. For males, it may result in decreased sexual ability, inability to produce sperm, or enlarged breasts. If you experience any of these symptoms, inform your doctor right away. Seek medical help immediately if you experience very serious side effects, including seizures, or symptoms of neuroleptic malignant syndrome, NMS, such as fever, muscle stiffness/pain/tenderness/weakness, severe tiredness, severe confusion, sweating, fast/irregular heartbeat, dark urine, or signs of kidney problems. If you notice any symptoms of a serious allergic reaction such as fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist. When using Zyprexa, it's important to note that there may be a slightly increased risk of serious, possibly fatal side effects for older adults with dementia. This includes conditions such as stroke, heart failure, fast or irregular heartbeat, and pneumonia. It's crucial to discuss the risks and benefits of using Zyprexa with a doctor, especially when treating dementia-related behavior problems. Additionally, if Zyprexa is being used in combination with other medication to treat depression, it's important to carefully read the drug information for the other medication. As for the daily dosage and timing, it's best to follow the doctor's instructions for the most effective treatment. Before starting Zyprexa, it's important to talk to your doctor about any allergies you may have or any medical conditions you have had in the past. This medication can cause dizziness or drowsiness, so it's best to avoid alcohol or marijuana while taking it. If you have surgery planned, make sure to tell your doctor or dentist about all the medications you are taking. Zyprexa can also make you more sensitive to heat, so it's important to stay cool and hydrated in hot weather. If you are pregnant or breastfeeding, talk to your doctor about the potential risks and benefits of taking Zyprexa. And lastly, if you have any concerns about the side effects of this medication, be sure to bring them up with your doctor. It's important to be aware of any potential drug interactions with Zyprexa. This medication may interact with other drugs, changing how they work or increasing the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Zyprexa is metoclopramide. Additionally, if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, make sure to inform your doctor or pharmacist. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Be sure to ask your pharmacist about using those products safely. If someone has taken too much Zyprexa and is experiencing serious symptoms like passing out or having trouble breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness or dizziness, fast or irregular heartbeat, unusual or uncontrolled movements, and seizures. It is important to not share this medication with others. Your doctor may also require you to undergo lab and/or medical tests such as blood sugar, weight, blood pressure, blood cholesterol/triglyceride levels, and liver function while you are taking Zyprexa. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Zyprexa, take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed one. Take your next dose at your regular time. Don't take double the dose to make up for the missed one. It's important to store Zyprexa at room temperature away from light and moisture, but not in the bathroom. Keep all medications away from children and pets. Make sure to properly discard this product when it's expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.